Oh, no. Oh, no. The death of me.
Maybe we'll get it from.
Oh, my goodness.
So let's just break it up into the four types. Respiratory. Acidosis. And respiratory alkalosis. What do we have to know before we can ever start any numbers? Who?
ABG?
pH. pH is number one, always pH. So if your pH is greater than 7.41, it's going to be alkalosis. And I'll tell you why here in a minute. If your pH is less than 7.39, it's going to be acidosis. So perfect pH is 7.4. That's perfect harmony. Our range is 7.35 to 7.45. If your pH is in here, you've got compensation. If it's 7.41, 7.42, 7.43, 7.44, 7.45, 7.46, all the way up until whatever, it's gonna be alkalosis. This will tell you if it's compensated or not, if it's in between those two.
If it's between those two, I'm sorry.
You said 7.4.
7.4
The
is
higher.
perfect harmony. That's where you wanna be. That's what the body wants to be. 7.4 is perfect. But it ranges between here. But the lower it goes, the more acidic. The higher, the more alkalosis. But if it's in between these two, it's compensating. That means the other system is trying to fix it,
Right.
whether it's respiratory or metabolic. So, acidosis is going to be low or high. Alkalosis is high. These two are gonna always be the same when you're talking about the metabolic system. Acidosis is low, metabolic is low. Acidosis is high, metabolic is high.
High pH.
This is the pH.
Okay.
This is the HCO3. So, if you have a pH of 7.30 HCO3 of 18.
Acidosis.
That's low and that's low. Metabolic acidosis.
But how do you know it's, okay, what determines when it's how do you know when it's respiratory and?
Wait a minute.
Comes.
Hold on.
Metabolic or respiratory.
So these are the numbers you need to know for metabolic, HCO3 and pH. Respiratory, you need to know CO2 and pH. CO2 and pH. So acidosis is what?
Yep.
So if it's low over here, then this can't be low in it. So that one's gonna be high. So for respiratory acidosis, CO2 is gonna be high, pH is gonna be low, always.
Oh, shit. Respiratory.
Respiratory, this one's gonna be low, this one's gonna be high. So their values are gonna go in the opposite direction. If it's respiratory, they're gonna go in the same direction if it's metabolic. So, your pH is 7.49, and your CO3 is 30. And the HCO3 is 24. Is it high or low?
pH is high.
Is it high or low?
Low.
Low. And that one is
High.
So if they're going in opposite directions, what does it have to be?
The HCO2 is the,
Respiratory alkalosis.
oh,
What's the difference between CO3 and HCO2?
Why do I keep doing that? I'm sorry. God, I keep wanting to make that up. So, in the body, it loses an oxygen molecule, and it was CO3. We lose one and it's CO2, and this one we gain one. But you don't have enough, no. CO2, HCO3. I need to stop.
So give us one more.
Respiratory alkalosis.
Is this compensation you're teaching us now?
No. I didn't put it. Just know that, I'll give you a compensated one. 7.36 is my pH. HCO3 is, oops, I need to put them all on the same side, so I'm gonna do that. 18. And then, respiratory is going to be CO2.
So how do you know what is there?
Respiratory acidosis.
Say it again.
Respiratory acidosis. Is it?
So this is what?
Is it metabolic?
So that's an acid. What is this one?
Metabolic.
Is it acid or?
Oh,
I forgot the range.
acid?
It's alcohol, isn't it?
It's 22 to 26.
So it's metabolic acidosis.
And 42 is. 7 is acid.
So he's a problem with everything.
How do you know?
Okay.
So
Mm.
everything is off. This tells you that it is,
Rest.
it's compensated, it's compensated, because it's 7.36.
So what is it telling you?
So you have an acidosis,
The body's working for,
and it's compensated. So how do you know what caused it? Which
higher
one
one.
is the most off?
The metabolic,
47.
is it? Or,
I think it's the 47.
mm-hmm.
There actually two, that was a bad example, hold on, sorry. Let's put it 6, because I put them both at 2. My bad. So whichever one is the most off,
The
it's the
16.
problem. So this one is by 4 points, and this one is by 2
By 2.
points.
I guess we gotta know our values.
Okay, let's take the 19.
I'm not gonna
Yeah.
give you one like that, but since you asked,
Mm-hmm.
but you won't have one like this. I promise, I won't do that. Now, that doesn't mean you're not gonna get in a capstone, because you are.
Mm.
I don't want capstone.
So your pH is 7.49. Your CO2 is 28. Your HCO3 is 24.
Mm.
Alkalosis, respiratory alkalosis. So yes, that is respiratory alkalosis. So your pH tell you whether it's acidosis or alkalosis, then you find what matches the pH.
Are we getting a lot of this, what's it
Three.
called?
3 questions?
One, you have to actually solve the problem, and the other, you have to solve for it. So have y'all wrote this down?
We've been doing this like all year, right?
Have y'all wrote this down?
Yes.
This piece?
Yeah.
Okay. If your patient has COPD,
Respiratory acidosis.
respiratory which type?
Acidosis.
Yes.
Because they're keeping the
They're
oxygen.
holding it in, so a COPD patient has respiratory acidosis. So give me a number that would equate to respiratory acidosis. So what's acidosis, what's your pH gonna look like?
7.31.
Mm-hmm. And a CO2 of,
And
7.46.
how many?
46.
46?
46? And your HCO3?
23.
23.
Because the HCO3 is gonna be normal,
Yeah.
right?
Mm-hmm.
The only thing that's gonna be high is the CO2. Okay.
Cause the
There
more
you go.
acid you have, the higher that CO2 is gonna be when you're doing this stuff. If you have a patient that has an NG tube,
Metabolic acidosis.
metabolic who?
Acidosis.
Why? Where's that tube at?
I said acidosis.
No, it's alcohol.
Why?
The
Can
tube
you?
is in your stomach, acid is in your stomach, you're removing it. So the more acid you remove out, the more alkaline it's gonna be.
Got it.
So what's your number? What's your pH gonna look like?
7.47.
And what is your HCO3 gonna look like? 27, you said? And what is your your CO2?
45.
It's normal, cause it's 35 to 45. So you'll have one.
So what's high here? Metabolic alkalosis. So your pH is gonna be high, and then
And so is your HCO3.
and your HCO3 is gonna be high. Okay. Okay.
You'll have two like that and one where you have to solve.
Practice. Yeah. Yeah.
Since that's what I put my mathematics.
Yeah.
Okay. Raynaud. What do you keep your patients away from with Raynaud?
Extreme
Extreme.
temperatures and
Extreme.
what is it? The pseudo epinephrine vasoconstricting, right? So avoid.
And so what kind of medicine are we gonna give them?
Vasodilators?
Which medicine is vasodilator?
Is it the
Nitro.
Rapamil?
What is a nitro?
Nitro patch?
What kind of medicine?
A vasodilator.
And what did you say?
Rapamil?
What kind of medicine is that?
It's the channel blocker.
Yep, so calcium channel blockers.
For
work
the
Raynaud.
renal?
Yes.
The one that we just took the test on, right? That's spelling? Okay.
Avoid calcium channel blockers.
No, they
No,
can
good,
have,
good.
they can
Wait,
have,
wait, wait. What?
they can have calcium.
Yes, they can have, they
But
take
they
those.
can't
They
have
need
the
to avoid the
Pseudo-
pseudo. Okay.
Pseudoephedrine.
And
Pseudo.
they will get nitro too?
They
Okay.
could possibly for the vasodilation, but we start with the lesser two evils. So we're gonna start with those calcium channel blockers. And what are we gonna teach our patients that take calcium channel blockers?
Muscle cramp.
Yes. Are we worried about hypotension?
With who?
Calcium channel blockers. We know it's gonna happen. So what do we tell them? Cause it's more, we're worried about those muscle cramps.
The
Hypotension,
The stand.
rock
the orthopedic.
slowly, dangle, take it at night. If your patient has a peak T wave, so you got your heat, heavy stress, and then here, it should look like that, it should be like a little hump. That's your T wave, right?
Yes.
But they don't have, they have this for their T wave. What imbalance do they have?
Potassium.
Which one?
What?
Hyper because it's tall. Why?
Hyper.
Y'all say hyper?
I don't know.
At this time?
Hyper. It's wide and it's tall and yes. Hyper.
Oh, that was good. There you go. That's good. Hyper because it's
Remember
tall.
with potassium?
Wide and
Yes, if it's potassium, your body is going to get excited if the potassium goes high. So, other than this tall T wave, my QRS should look like this. Oops. It should be very narrow. And if it doesn't, because of the hyperkalemia, it's gonna be wide. And, so we got our T wave here, and then your ST segment should be here. It should kind of like match that line, but if it goes up, that's an ST elevation. That happens with hyperkalemia too. Don't judge my drawings. I didn't do good in art. It's not my thing. How do you treat supraventricular tachycardia? Yes. How do you treat AFib?
Atropine. Obese.
With what?
Calcium channel blockers.
Yes. Give me an example.
Remandro.
Verapamil.
And if we're gonna do cardioversion electronically, we're gonna shock it. So you're gonna use your defib, but it's gonna be in cardiovert mode. So what do you have to make sure you take off your patient?
Metals.
Your patient that is taking a beta blocker, what are you gonna teach them?
Orthostatic hypotension.
Check the
And
Check
check the pulse for
1 minute,
4 minutes. And hold it if it's below.
60.
I'm glad you couldn't.
So your patients that are taking your, the Johnson,
0.5 to 2.
signs of dish toxicity.
Halos, anorexia, bradycardia. We know those.
If your patient has cardiac tamponade,
Fluid.
What was the answer on the exam?
Oh, right now,
S1, S2? No.
you have JVD,
JVD, jugular vein, yes.
a narrow pulse
Jugular
pressure,
vein
Mhm.
distension.
and hypotension.
But a narrow pulse?
Pulse pressure. So what does that mean? When you take their systolic blood pressure and then their diastolic, it's less than 10 millimeters per Hg.
Oh, this one said wide pulse.
Yeah, narrow.
So it was JVD, yes.
Okay, pericarditis. What is pericarditis?
Painful. Lay them on the side.
Yes, lay them on their
What was
side.
the answer?
Do not put them supine. Lay them on their
I put
side.
lateral.
We're trying to decrease
Yeah,
that
And the pericarditis is
and put them on the bed rest.
inflammation of the pericardium. Perfect.
For a patient that's having an MI, or you suspect they're having an MI, what is the first thing?
EKG.
EKG. And if it's a STEMI,
Cath, 90 minutes.
cath lab. And if they're going to the cath lab, we're either doing a stent, a balloon angioplasty, or we're just looking around to see. And if we're looking around, we're injecting dye. So what medication?
Metformin.
Metformin.
If your patient's having a stress test, what do you withhold?
Everything that may interfere with their stress. Blood pressure patch.
To alter their
Alter
heart
the-
rate,
yeah.
because we wanna make their heart work.
So anything that may alter their heart rate
Or blood pressure.
or blood pressure. Okay.
Cause if we're altering that blood pressure,
Okay.
heart rate's gonna go
What was the thing you said right before the study though?
I need potassium.
And I said so much stuff, I have no idea.
It was after like the lateral pericarditis patients for the heart condition.
Before pericarditis,
Yeah, after that, and then you said something before the study. Wow, I just wanted to know which was it cardio?
It's recorded.
oh, she's got it recorded,
Oh.
I have no clue.
I know.
Sorry.
It's alright.
If you have
Do
a
our best.
patient that had rib fractures and they've got flailed chest, what will you observe?
The paroxysmal.
Oh, so that's.
Paradoxical
Paradoxical.
chest movement.
When I see it, I know it.
Yeah.
Yes. And why is that?
Because the ribs are broken.
More than 2 weeks, more than 2 weeks.
More than 2 ribs?
Multiple ribs are broken
Yes,
in multiple
multiple.
places.
So is that when they're gonna splint?
Yes,
Okay.
we're gonna splint for pain. Weight loss side effects. ACE inhibitors, diuretics, complicated sex, rib fractures. When you're performing trach care, what do you have to make sure you do first?
Secure the trach.
Make sure you have at the bedside your
Comes out and ruin your shift.
trach care.
You gotta be sterile. You have to be sterile to do trach care.
You have to be sterile, but what do you have to have, you said, right?
what do you do first?
Oh, okay,
We're gonna do
sterile.
sterile technique. We're gonna clean the outer and the inner cannula, and we're going to hyperoxygenate. So give them oxygen first. Please make sure you have ties. Don't take the ties loose without replacing. Y'all see something
Does that turn off by itself?
in that room in there?
Yes.
Yeah. It does.
Oh, good.
Like, what do y'all keep looking at? Alright, so, don't remove the old ties until you have the new ties on because they can dislodge. And if there's a chance that your patient's gonna dislodge, it's usually when that first 5 days of getting no trach. So what do you need at the bedside?
Obturator.
Obturator. Gotta have an
Obturator.
obturator so that you can open them back up.
Okay.
Why can't you just call us?
Because your
they take
patient's
forever.
dead by the
They're gonna
time
be
they
like,
get there.
I'm break. Call Susan.
Because if you work at Baptist, the respiratory tech comes in 20
what is
minutes.
Nevi? What is Nevis? N-E-V-U-S. What is that?
What is what?
Mm.
Nevis, N-E-V-U-S.
What is it? M?
N?
I don't need. Can you write that?
Is it
I don't know.
a type of oxygen mask?
Nevis.
Something in your skin.
Oh,
It's just a
gosh.
Oh.
Really?
Oh,
That's all of it. But know that name, Nevis. So what do you teach your patients about their Nevises? What are they gonna
To watch them.
Symmetry, color.
Lord, or ABC.
A, B, C, D, E.
A, B, C, D, E
If
for
there's a change
Nevis.
in the size, the color, then they need to be seen a doctor immediately.
Notice how everybody stopped writing?
Over it right
Yeah.
now, over it.
Receive that?
Yes, I'm gonna send you
Yes.
this.
Yes, please.
We didn't send a spirometer, okay. Before I let you go, couple of things, hold on. For you peoples, write it down, work it out. We have an order. 2 micrograms per kilogram
Mm.
per minute.
A-type.
Mm-hmm.
That's the one that got me.
Pounds.
Per what? 2 micrograms per kilogram?
Uh-huh.
Per minute. Okay, thank you.
Available, you have 200 milligrams and 250 mLs. What is your mLs per hour?
Milligrams.
Oh, this is
We're supposed to do it now?
Oh God, this is soaked.
Oh, it's wet. I'm sorry, I sprayed them.
Okay, hold on, that's okay.
Yeah, I sprayed them with Lysol. Cause it needs to sit for at least 3 minutes. 250 mLs of normal saline. And here's at 15 mLs per hour. Oh, units per hour.
Been 25,000. In 250.
Very nice space.
puse mi. Pero sí puse mi.
Your answer.
Right? Ah, okay.
Yes.
Oh, wait, I didn't do it. Only 1 second. Oh my goodness, I didn't know we're supposed to do it.
Oh, you wanted
Just
us
write
to.
it down. Write it
I
down.
know how to.
What is ml? So what is it? 8 ml per hour?
Yeah, cause it's 7.5, then you gotta round it. I promise I'm gonna fix it. The exam, I'll make sure it's right.
So it's 2 milligrams per day? So what are those 25 questions we've never seen? What are they on?
I'm about to tell you. So your quiz, you have a quiz 5 that's due, right?
Yes.
So I didn't upload it for y'all because I was here, sorry, I need to upload it. So I want you guys for your quiz 5, it's on hearing loss and vision loss, and I'm very specific in what I asked for hearing and vision loss. So for vision, I asked you to tell me the assessment for retinal detachment, cataracts, glaucoma. I asked you about 3 different medications. Whatever is on that sheet is the other question is on your exam for vision and hearing.
Whatever's
I thought we
on
did
that sheet.
before. Was it similar to the one we did before? It's just.
It's just a little bit,
The type,
More.
the type that you
more
gave us
focused.
before, the
Yeah.
symptoms, the
So-
I don't want you to do that though.
No.
I tailored it to
Yeah.
exactly what you need on
Okay.
that.
So what is on that sheet is
What we need
is
to know.
where those 25 questions will come
It's
from?
only like 8,
Mhm.
and the other ones are the stuff that we just went through.
Okay. So that quiz 5.
So
Okay.
you'll see some of the stuff we went through will be different than the questions that you saw, but you're gonna see over 50 of the questions are gonna be questions you've seen before. But it's the same material.